All right, good evening, everybody. I'd like to call the Wednesday, May 22nd, 2024 full board meeting to order. We'll start with the Pledge of Allegiance. Please rise.
Allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Next up, we will have a reading of the mission statement from Ryan. Also, welcome back, Linda and Ryan. Ryan, go ahead.
Thank you. Our mission, Macomb County Community Mental Health, guided by the values, strengths, and informed choices of the people we serve, provides quality services which promote recovery, community participation, self-sufficiency, and independence.
Thank you, Ryan. Next is the adoption of the agenda. I'll take a motion to adopt.
So moved. Support.
Motion from Selena, support from Lori. Changes, questions, comments? Hearing and seeing none, all in favor say aye. Aye. All opposed? Agenda is adopted. Next, we'll move on to hearing of the public. Anybody from the public wishing to speak? You have 5 minutes. Come on up and give us your name. Anybody from the public? Angel shaking her head no? Okay. All right, we will close the first hearing of the public. There is another opportunity before the end of the meeting. And we will move on to item 5. Item 5A, approval of the minutes of the regular meeting of the CMH full board held on Wednesday, April 24th, 2024. I'll take a motion to approve those minutes.
So moved.
Support.
Motion from Linda, support from Wayne. Comments, questions on the minutes? Okay, hearing and seeing none, all in favor say aye.
Aye.
Aye. All opposed? Minutes are adopted. Next is item 6, approval of the minutes from the CMH Board Program and Budget Committee meeting held on Wednesday, May 8th, 2024. I'll take a motion to approve those minutes.
So moved.
Motion from Selena, support from Antoinette. Comments or questions on the minutes? Hearing and seeing none, all in favor say aye.
Aye.
All opposed? Those minutes are adopted. And next, we'll move on to item 7, request to approve. We have several items from program and budget that we already discussed, and we also have a few new items. So I will start with the motion to approve item 7A through H, noting that item H has been updated so that Bruce can take a plane instead of a bus. Motion from Mark.
Support.
Support from Selena. Any comments, questions? All in favor say aye.
Aye.
Aye. All opposed? Motion passes. Next, we'll move on to item I. Request to approve 2024-2025 CMH Board Committee list. Take a motion to approve.
I'll take a motion, but I did want to note that it still had Dave Pankatow's name on there. I don't know if you wanted to leave that on there.
I guess we can do that. The ghost of Dave is still present. Motion from Donna with that change.
Support.
Support from Selena. And I believe I talked to everybody except for Ryan, who was gone. So too bad, so sad, you're stuck where you're at. All right, all in favor say aye.
Aye.
All opposed? Motion passes. Thank you, everybody, for continuing your committee assignments. Next, we'll move on to item J. I'll take a motion to request to approve a partnership agreement with the Macomb County 16th Circuit Court Juvenile Division, and this has been approved by legal.
So moved.
Support.
Motion from Linda, support from Wayne. Tracy, go ahead.
So this is an agreement directly with, thank you, this is an agreement directly with the 16th Different Court who oversees the JJC detention specifically. That being said, we're basically agreeing to be this gap. So there are individuals who are not Medicaid eligible, or as you guys know, when you're in jail, right, you're not eligible for these other things. So it's agreement that they're gonna pay us our Medicaid rate for the services that we would be providing, such as therapy, and you see them in the agreement, some of the other standard ones. It is not a large volume. This is actually a great way for us to start something. So when I say large volume, it's like 20 kids a year is what they project. But it's a way for their gap to be met, and it's also a way for us to start expanding our partnership with them and for them to see us as a viable solution for these gaps.
Thank you, Tracy. Any questions or comments? Okay, hearing and seeing none, all in favor, say aye. Aye. All opposed? Motion passes. Next is item K, take a motion for approval of the alternative outpatient treatment grant in the amount of $68,000. An additional $30,000 will be received in 2025 from this grant. This has been approved by legal also.
So moved.
Support.
Motion from Ryan, support from Lori. Nicole is here to speak on this. Sorry, Tracy.
She's the next one though, so, AOT is, I've been talking about it, it feels like forever, so this shouldn't look new to you guys, but we finally actually got the agreement. Actually started May 1st. So just as a refresher, basically the purpose of the money is for us to create some basic marketing materials and some basic videos to educate the public and educate individuals either on the AOT or law enforcement. So we'll end up having 4 separate videos that we could then share with the public on our website and other places. They are also covering some of the staff time to create those. So the actual cost to create the videos and materials and part of the staff time to do that is what this funding is being used for.
Thank you, Tracy. Any comments or questions? Mark?
The court is part of that, but a therapist or a hospital or anybody can say, I want to put somebody on an AOT, and they can begin that process. That's kind of why we're creating this, is because there's all these different avenues that an AOT can be used, and it's confusing. And an AOT can be misunderstood and actually make it very difficult for the person served and their providers. So we're trying to make plain language so there is less confusion about when this should be used, what are the benefits, but also what are the challenges.
Thanks, Mark. Any other comments or questions? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Next is item L. I'll take a motion to approve MDHHS CSUGS 2024 Grant Amendment 1.
Support.
Motion by Antoinette, support by Linda. Now is it Nicole's turn? I just really want to get you up here, Nicole. Put you on the spot.
Okay, so for the CSUGS grant, there were 2 changes that were made. One of them was a request from us to move funds from the treatment portion of the grant to the prevention portion. We had one project under there that was also covered by a different grant, so we weren't really using those funds. So we wanted to make sure we were spending everything and expand the prevention services. And the other change was updates to the special provisions that were attached. So they added language about what recovery supports could be funded by the grant, as well as some language about MDOC referrals that better matched what was in our PIHP contract.
Thank you. Any questions for Nicole? Comments? Not on this one? Okay. All in favor say aye. Aye. All opposed? Motion passes. Next, I'll take a motion to approve MDHHS SUGS 2024 Grant Amendment 1.
Support.
Motion from Antoinette, support from Lori. Go ahead, Nicole.
So for this one, for our SOAR 3 grant, MDHHS had just requested that we give them our updated contracts. They had fiscal year 23, they wanted fiscal year 24, so we made those updates and changes in egrams. And then they added the special provisions language that was added in the previous as well, about the recovery supports and the MDOC language. Same for the treatment grant. They added the special provision language for that one as well.
Thank you, Nicole. And for the thousands of viewers watching at home, can you give us what CSUGS is and what SUGS is?
So SUGS is substance use grant services. The C is for COVID, and then the other is for the regular grants.
Thank you. Anyone have any questions for Nicole? Okay, hearing and seeing none, all in favor say aye. Aye. All opposed? Motion passes. Thanks, Nicole. Item 8 is receive and file. We have no items there. Item 9, resolutions. No resolutions tonight either. Item 10 is the voucher listings. I'll take a motion to approve the bills. Paying the bills.
So moved.
Support.
Motion from Linda, support from Lori. Comments or questions? Got to pay the bills. All right. All in favor say aye.
Aye.
All opposed? Bills are paid. Next is management report. Start with the CFO update from Richard, not Ken.
Good evening. We've got a lot to update you on today, so my apologies. Buckle up. No, it'll be fun. I'm going to go ahead and do the normal monthly finance report update first, and then we'll talk about some of the things that Ken's been keeping you up to breast on. A couple of highlights for the March financials. I'll start on page 2 inside the front. As we look at revenue and eligibles, our eligibles continue to trend down through the month of March. Revenue also continues to trend down. Good news, we did meet with the state of Michigan. They did do a rate amendment that was effective April 1st. So next month you will see our revenue pop up, even though our eligibles will continue to trend down. Our revenue will pop up. It'll trend down again for May and June is what we expect. And then we're hoping by June, we're gonna start to plateau. Eligibles and revenue would stay relatively consistent. So good news from that perspective. We did a rough estimate. We believe the amount of extra revenue would annualize to about 5 to 6% higher than what we were trending previously. So that will be additional revenue you'll see. In terms of highlights for page 3, our cash and investments continue to stay very high again, both related to a well-funded internal service fund, which we're going to talk about in a little bit at a later update, as well as related to some of the funding that we're receiving in the CCBHC program and the funding we're getting through Medicaid that we may or may not be able to keep at the end of the year. So strong financial performance from that perspective. And then highlight for page 4, capitation is trending to be up about almost 40 million compared to prior year. And we do expect we're going to keep a good chunk of that related to CCBHC, which we'll talk about in a second. Page 5 highlights our performance through the month of March as it relates to our different programs. So for the regular Medicaid program, we're showing unspent funds of about 5.8 million. Healthy Michigan underfunded about 3 million. That's pretty consistent to what I'm seeing with other PHPs throughout the state, is that Healthy Michigan seems to be kind of underwater this year, and the Medicaid program is kind of helping fill that gap. So that's pretty consistent to what we're seeing. So again, we can use that money interchangeably. So it's not like we have a problem. We'll just use that 5 million to cover that 3 million. In the CCBHC Medicaid program, we're looking at a surplus through the month of March of about 3.4 million. So we do get to keep that funding. And then in the Healthy Michigan program, a surplus of about 1 million. So about 4.5 million approximately for half the year. So annualized to around 9 million we could put into local by the end of the year. Again, highlight on the risk reserve at the bottom, we expect to be fully funded at 66.8 million compared to what our actuaries believe is necessary to manage our risk. And as I'll come back to in a little bit after we're done with the finance report, the ISF is one of our big updates today. On page 6, through the month of March, our CCBHC non-Medicaid program is running a deficit of about 1.7 million. And again, we'll use some of that surplus in the Medicaid and the Healthy Michigan CCBHC to cover that. So that will offset that 9 million by about 3 million. So again, net 6 by the end of the year. Our state general fund is currently running a small surplus of about 300,000, although we're continuing to trend down with that. So as eligibles continue to trend down, we're trending up in how much we're spending. So we're actively managing the general fund spend at this time. And then all other grant and local programs surplus through March of about 2.6 million. Those are my highlights related to March financials. And before I get into some of my other fun updates, are there any questions or concerns about March financials? Okay. So, in order of topics, I think the first one I want to give an update to, I'd like to update you on our what's called medication-assisted treatment program. It was actually part of the special provisions that Nicole was talking about earlier in our CSUGS program, so it's part of our SUD program, and it's also part of the new 2024 contract amendment on the Medicaid side as well. So a little of the history there, the state came out with boilerplate language that said, they expect a PIHP to pay $19 per unit for every unit of methadone, or medication-assisted treatment, but specifically related to methadone administration. There are 2 PIHPs in the state that pushed back and said there's a couple reasons why we feel this is inappropriate. One of them being that it requires CMS prior approval before we would implement. And part of that being it's a significant increase to what our providers were willing to accept for payment. We went from around $8 a unit now up to 19 would seem potentially excessive. So we've requested that the state provide us guidance on why that's appropriate. So just a little update there. They did provide us a memo on the block grant side that said we've reviewed this and we believe that it's reasonable and appropriate for you to pay that money on the block grant side. But the contract language didn't make it into the contract amendment, which was very interesting. So they said, we're going to put this requirement in your amendment. It didn't make it into that. It didn't make it into the SUGS block grant piece. On the Medicaid, they have put it in. So at this point, we're kind of in an interesting holding pattern, want the board to be aware. Right? We're not planning on paying providers yet at the $19 per unit until we see that CMS approval letter. So that's a requirement. And then we would need the contract language in our SUGS contract. So in case you do start to hear some feedback from providers like, hey, you owe us money, why aren't you paying? We're still waiting for the appropriate documentation from the state to approve that. So, but we have seen movement on that from the standpoint of the state saying this is coming, it's going to happen, you need to be prepared to start paying, but we're kind of in this hurry up and wait position right now. So I don't know if, Tracy, you've heard anything more or in addition to that?
No, just that it would go back, if it's in there, it would go back to 10/1 of 2023.
Yep, that's what the state's wanting us to do, so. The other one, and probably a little bit more time, is related to the internal service fund. So as some board members may remember, so about a year ago, actually a little over a year ago, we started conversations with the state of Michigan about how to appropriately fund our internal service fund. We had reviewed the contract language as it existed, and we identified that the Medicaid contract language had changed in such a way that the previously applied or implied cap of 7.5% on our internal service fund no longer existed. And so we did our research, and it became apparent to us that we can and should actually do a funding of higher than 7.5%. So we got an actuarial evaluation, so to evaluate our risk based on the number of eligibles, based on our spend pattern, and they came back with a recommendation that we actually fund up to approximately $43 million. So between last year, 2022, report, and then this year, or I should say last year, but we submitted it in February of 2024, we funded up to that actuarially required or recommended amount of $43 million. Within the last week, so approximately a week ago tomorrow, we received proposed contract language from the state of Michigan for our fiscal year 25 contracts. This is fiscal year 25 contract language. And in that contract language, they are proposing language that would cap, so it's very clearly caps our internal service fund at the 7.5%. So they're trying to put that cap back in. And more importantly, not only are they trying to put the cap back in, but they're saying if the department determines that we're overfunded at some point in time after that, then we would have to return that money within 1 year. So the practical implication of that is they are basically saying, oops, we want all that money back. So that causes us concern from a couple of reasons. Number one, we have an actuarially sound analysis that says we need this money, right? And when we think about the past where Macomb was even 4, 5, 6 years ago, right, having a well-funded ISF would help us avoid some of those financial pitfalls that we saw in the past. So obviously we don't want to give that money back. And so we've started conversations with other CFOs and CEOs across the state. What does everyone feel about this language? What do we want to do about it? So just to give you an update, there are a few of us that feel very strongly that this language is inappropriate. It does not allow us as a PIHP to manage our own risk and our own business operations. So we feel like it's an overreach from the state. And there's a couple of actions being taken. So number one, we are going to try to obviously negotiate this language out of the contract between now and September 30, when the new contract would come into place. If that fails, there has been some movement. I can share Region 10's board met last Friday. The board recommended a resolution that is being drafted and is subject to their approval that would formally oppose this new contract language and all the reasons why. So the board actually directed management to draft that resolution and present it for their approval. And then we've also retained legal counsel to assess what our options are to counsel us from Region 10's perspective on what to do next. So it's an area of concern across the state, and it's an area that we just want you as a board to be aware of, that we're kind of stepping into this situation. So, and again, so to put some numbers to that, for Macomb, that would be giving back about $23 million of Medicaid out of the internal service fund, in addition to other Medicaid funds that we might be giving back related to the current year. So it's very interesting that they're trying to claw that back from prior fiscal years. That's a little frustrating to me. So wanted you to be aware of that's where we stand. And with the signing of the contract for fiscal year 25 potentially coming up within the next few months, if there is action to take, we'll have to take it relatively quick to address that concern. So I don't know, Tracy, anything else
No,
from
we
the
just want
CEO's
to urge you to
perspective?
consider options, including some of the ones like a resolution as an example. And I know Richard's talking about Region 10, but it's my understanding that there's multiple other regions, and this is happening pretty quickly. So I know of at least 3 others in addition to the one that are doing some type of resolution, some type of just expressing their opposition to this approach. So we would encourage you to think about that as a potential option, or other options that you think would be, it is in our best interest. Like Richard, I can't stress enough, this is not just about how to move forward. It's that they're wanting us to give back what has already been established as a fair practice.
So I'll pause there.
I was gonna say, does anybody have anything to add? Ryan, go ahead.
Is there a sample resolution could we have Region 10's resolution to look at? And then maybe we could
I'm sure we could get
consider
one,
it.
we can ask.
Something that, rather than write it from scratch.
Yeah, my understanding is that Region 10 has offered that once their board approves the resolution, which we expect would happen relatively quick, that it would be shared with all other PIHP boards across the state. So absolutely, absolutely.
Thank you, Ryan. Any other? Selena? You're on. You're good.
So would it make sense for us to join together and have one big resolution with all of the CMHs instead of a bunch of little ones coming in?
That could be an option. I would say that could be considered. I know a lot of the PIHPs, their board meetings are kind of staggered throughout the next couple of months.
Okay.
One might not even be meeting now until July. And so I don't know if the timing will work for everybody to approve the same exact resolution, or if, so.
Yeah, so
but
we
I-
might not want to wait. So let me ask you a question. What happens if, so let's say that this goes through and we have to pay back the money on previous years. What happens to the CMHs and stuff that don't have the money to pay back? Are they going to then have to get less money on a monthly basis? I mean, this could put some organizations completely under where we were a few years ago, where we had to pay back money and we didn't have the money to pay back, and it threw us in the red.
No. So at this point in time, as far as I'm aware, there were 4 regions that took this position that said, to appropriately fund our ISF and to appropriately manage our risk, we need to put more money into the internal service funds. That would be ourselves at Macomb, Region 10, the UP, and the Northern Michigan Regional Entity, which is approximately Clare North in the Lower Peninsula. So the way that this is worded is fairly specific. It would only impact those that put extra in. they would then claw that back. And then for everybody else, it would be a going forward issue. So we would not expect it to impact Lakeshore Southeast. So at least the department is recognizing that they're not going to end up taking from those that don't already have, if that makes sense. Now, everybody, even those that didn't put in extra in those years when you know there was extra funding to save, they recognize that they would have if they had had the money to put it in, and so they are still to some extent in opposition of this language, because they're like, philosophically, we as the PIHP need to be able to manage our risk in our own business. But as Tracy said, a couple have already spoken up and said that they're in opposition. I think some are still considering how formal they want their opposition to be, if it's going to be a board resolution or how they want to proceed. So it'll be interesting.
Thanks, Selena. Donna?
Yeah, I totally agree with the resolution and that we should go forward with that, but is there another, I mean, I don't know how effective the resolution will be, you know, with all of the different regions doing that. Is there other forms that you would recommend of effective ways to respond to this?
Yeah, so so Region 10's board, so the request that I made to Region 10's board and they authorized it was to retain legal counsel to find out what our options are. So Region 10, at least as one PIHP, plans to seek counsel from that perspective. My personal experience with the department over the last 2 to 3 years is that when they dig their heels in, they really dig their heels in. And so I am concerned, and I prepared the Region 10 board that we may need to be willing to take legal action to actually, you know, potentially put some sort of something in place. Absolutely. Mhm.
Thank you, Donna. Linda?
Just curious, Region 10 is our neighbors to the north of the Thumb, St. Clair, and,
St. Clair, Sanilac, Lapeer, and Genesee counties.
thank you.
That's correct.
And you are there,
I'm also their chief financial officer.
I think the vibe I'm getting is I'll work with Tracy and Richard to get language from Region 10 to at least start there and bring it before program and budget for Ryan's first one back so we can have a good time. But we can at least start there. And then in the background, I guess I can even check with Corporation Counsel and see if that's something they would be interested in joining on to, at least have that initial discussion with them, if that would be okay with the board and if that makes sense to you, Richard.
It makes a lot of sense to me. I think, you know, a lot of the conversations with the state is like, well, why does the PIHP need all this money? And it's like, well, time out just a second, right? You have to remember this money is not just relied on by the PIHP, it's relied on by our providers, by the people that we serve. I can't stress how many times providers have communicated, I'm sure to Tracy, but to myself as well, to say, it feels so good to know that we're not where we were 6, 7, 8 years ago in terms of Medicaid funding, and that there's a level of, stability, less anxiety in terms of the fact that we're going to be able to continue on as a provider network, and to help the state understand how important this is for that within our communities is something we're trying to do. But yeah, I absolutely support. This is one of the areas that is worth our effort to protect for our community.
One of the other suggestions I would make is myself, Richard, I think Tony and Ken are meeting with the executive's office. That wasn't the main subject, but this will be one of the subjects, just to have a more unified front, because we are suggesting, yes, this board, but as a county-wide, this impacts the people we serve, so to also get support from that avenue.
And then I believe you wanted a little bit of an update on conflict-free. Do you want me to jump into conflict-free?
Sure, and then I have some stuff, but yes.
Okay.
Richard, before you go, any other ISF questions before we move on to the next good news item?
Yeah,
No? Richard, go ahead.
Okay. So I've been talking to Tracy and others, of course, here locally, but also across the state about the new conflict-free access and planning that the state has proposed, mandated. They're in an interesting position right now because we were supposed to know more, I think, yesterday, and then they canceled that meeting kind of abruptly. So we don't know exactly where the department stands on it. What I can tell you is that across the state, we do see conflict-free access and planning as a concern. From the standpoint of maybe it may not impact us from a dollars perspective today, but as a CMH, we do have a statutory requirement. So I'm taking the PIHP hat off for a second. As a CMH, we have the statutory requirement to manage the program, the mental health services program within our community. And some of that is a local decision on how we implement, right? And so there are a variety of CMHs across the state that see conflict-free access and planning as a violation of the mental health code. There was actually a resolution recently passed by the Mid-State Health Network PIHP board as representatives for all of their CMHs to this effect, that it violates the mental health code. And I think one of the things that's helpful for a board to know is that the state will, or has within the last month or two, they'll say, well, this is a federal requirement, right? This is a federal requirement that we have conflict-free access and planning. And while that's true, there is specifically federal language that exempts or can exempt, if the state chooses, governmental entities. So CMHSPs, of course, are governmental entities, just like Macomb County is a governmental entity. So the state could choose to exempt us from conflict-free access and planning. They've chosen not to. So this is a policy choice at the state level, not a federal requirement. So that's a clarification that I think is worth communicating across the state. This is a state policy choice, not a federal requirement, and it conflicts with state law. So there has been discussion, and I'm sure you've seen some of the action items coming out from the association about how do we legislatively address our concerns related to conflict-free access and planning. Some boards are doing resolutions related to that, and some are actually considering if they have to protect themselves, again, potential legal action. So again, so you're aware this is a statewide issue, and it especially impacts the CMHs. So that's where you may not hear some of our PIHP colleagues being as strong worded about this particular issue. It's because it is a CMH or a provider level issue within the state. So
In front of you, you do have a copy of the mid-state resolution that Richard was mentioning for your reference. You also have the infographics that the state association has created, so if you wanted to refresh, because I know this has been a hot topic for a while, but if you wanted to refresh your memory on kind of like the basics of it, both of those items will help remind you. And I just want to reiterate, from an operational standpoint, I'll talk about it a little bit more in a minute about the CCBHC, but it creates more challenges when we already have staff shortages, when we already struggle finding the right provider for the right person. So now we're going to have to create two providers, not because that's what the person wants. It's because the state is making us check a box. Like, their motive is good. We don't disagree that there needs to be conflict-free services, but the way that they're interpreting and wanting us to do it is where we're in great disagreement with.
And this is something that we started discussing even when Dave was still here. And
Yes.
if memory serves, we did do an initial resolution that we may want to freshen up and kick out another one, or kick out the same one that we did, because we were one of the early ones on this issue months ago.
I think I agree. When you did it then, you guys didn't have the details of the details yet. Now you have a little bit more of the details, and that's where Mid-State in the example is able to directly say this is where it's violating the mental health code, if that helps, right? Because they've narrowed it down more specifically, where before they were talking more on a higher level or theory of the approach. But yes, absolutely.
Are there any questions or comments for Richard on this item? Nope. Okay.
is there anything else you wanted to make sure that, any other good news you wanted to make sure I communicated today?
Seriously, where's item 4?
It's next month.
Where's the check, Richard? Where's the big check? that we're
Right.
supposed to cash in?
Congratulations. Yes. So thank you again for your time this evening. I do appreciate it.
Thank you, Richard. Thanks for making the trip. Appreciate it. Next, we'll move on to the interim CEO update with Tracy.
So just to build off Richard's good news, I know there's a lot of moving parts lately, and a lot of things that are challenging our system. that really shouldn't be. So I just want to remind you, one of the things that we're frustrated with about the conflict-free is what I said, providing enough services to the right people and having the right people to do it. CCBHC, just to remind you, you have to have 51% provide services directly. Conflict-free, if you're the case manager or the planner, you can't provide other services. So do you see, if somebody said, what direction does Macomb County Community Mental Health want to move? Do they want to do more services themselves? Or do they want to get providers to provide services? We can't answer that question because literally they contradict each other in the direction that we need to move. Which, when you're already in a system of care that you're trying to be innovative and you're trying to start new programs like the CSU, the Engagement Center, that all takes staff and hiring. So I just want to draw your attention that this is about not just what Richard explained, but it's holding us in a pattern and not allowing us to successfully move forward. So I just wanted to make sure CCBHC contradicting, or at least from a systematic approach, conflict-free access and planning. The second thing is I did give you guys a draft letter. I think some additional actions will be taken as far as next steps, trying to suggest a better design for the CCBHC. So I just look forward for us moving forward that. Just as a reminder of the timing of that, we would need to do something and get something out there in June, like beginning of June, in order to express our frustrations or express kind of our suggestions of how to do it successfully. So that's the challenging part. I will move on to some better news. I did send out the board report earlier today, so it has all the links. A lot of the stuff that we've just spoken about, it has some additional substance, including some of the handouts, so you can click on it and learn more. We did do the MEA. One of the things you'll see in there is the MEA TV interview. You also have Libby Vuzzi, who is our Director of Community and Behavioral Health, is featured in the Macomb Daily doing an editorial, because May is obviously mental health matters. And then just to tell you a little bit about events, we continue, and this is the busy season for events, and so is the whole summer, which is a great thing to have. As an example, this Saturday, we were at three different kind of places. Everybody's going everywhere. We did have the privilege of being at myself and Kayla, the UAW Region 1, and presented with Alan Bolter on just kind of like not just what services are available, but also kind of what are the policies and practices, and some of the same things, although not quite as in-depth, that we just talked about that are impacting the community we serve. Other things, Richard covered those. You do have this in your board report, but there is some additional, or still continues to be some interest from the Medicaid health plans trying to ask us to be a provider for them. So I just wanted to give you a heads up that we are talking with some, and I said this before, to learn more, but there are some that are basically willing to do whatever we want. In other words, they're willing to look at maybe a smaller group. So I just want to give you a heads up that we're still looking at that, having conversations, not making any commitments, but we do see it as a possible prospect for us, especially with all these changing systems, to have another path and direction might give us some more options. And then I will leave with really good news. If you don't remember, tomorrow is our Mental Health Matters Awards, and I want to make sure to thank Lori. If you don't know this, all day today, Lori was racing around the world, picking up stuff and dropping it off and everything, and we're very excited about it. There's a few last minute touches that need to be done. One more trip for me. It is a big production to put on, so I greatly appreciate all the staff. There's a ton of staff that have made this successful. And again, just because I said I would celebrate Bruce all month, just a reminder, he's one of the winners and he's here. So,
Yeah.
Yes.
And that's all I have.
Thank you, Tracy. Any questions or comments for Tracy? Thank you, Lori. I know it's a lot of work. We've talked a few times. You've traveled about as much as I have in the past 2 weeks, so thank you for that. All right, with that, we'll move on to other possible agenda items. Program and budget will be here Wednesday, June 12th at 6 p.m. And starting with full board, and for a few meetings after that, we will be meeting at the CMH West location on 15 Mile Road, because this room will be going under some construction, some changes. So we're being kicked out for 3 or 4 meetings. So Wednesday's full board meeting on June 26th will be at CMH West. We will send several email notices so you don't forget where to go. Sandy will pepper us with several emails, and we'll make sure to have it posted for anybody else that wants to show up. With that, we'll move on to provider comments. Any providers that wish to share any news with us? All right, nobody's budging, so we'll move on to item 14, hearing of the public. Anybody from the public wishing to speak? Anyone from the public? All right. I know, because
What does that mean?
we're making eye contact, because I'm like, come on down. All right, we will close the hearing of the public, and I will take a motion to adjourn.
Move we adjourn.
Motion from Wayne, support from Selena. All in favor? Aye.
Aye.
We are adjourned. Everybody have a good night. Hope to see many of you tomorrow.